Good afternoon, everyone. My name is Kim Bittner, and I'm with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Webinar. This event is held in partnership with the Centers for Medicare and Medicaid Services. This call is being recorded and will be posted on the NCC COVID webpage, usually within 72 hours, but many times sooner. Before we get started, we have a program update. After reviewing the feedback we've received from you, starting August 5th, the COVID-19 webinar events will move to every other week and at a new 1-hour time. So the first professional webinar event will take place on Wednesday, August the 5th from 3 to 4 p.m. Eastern Time, and the patient webinar event will take place on August the 11th from 4 to 5 p.m. Eastern Time. We thank you for the feedback that you've provided us about the COVID-19 webinar events and the COVID-19 resources. We will continue to make adjustments where we can. The webinar events will continue to feature patient and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. So let's take a look at the agenda for today's call. Our speaker is Dr. Janice Leah. Dr. Leah is with Emory University School of Medicine and is the Chief Medical Director of Emory Dialysis and serves as Director of Telenephrology. Today's topic is also something that we heard from patients that was important to you: myths and facts about COVID-19. Many of the patient subject matter experts who partner with us shared about the overlapping information they received, how it feels overwhelming sometimes, and the desire to know how to decipher fact from fiction. Dr. Leah joins us to help answer questions submitted by patients, targeting those common and sometimes not so common myths. As we go through this presentation and you have questions, please submit them using the chat feature through WebEx or the Q&A on the lower right of your screen. When we get to the question and answer section of this presentation, we will share the questions we've received with Dr. Leah. Our goal is to answer as many questions as time allows. So what is this call about? Our webinar events offer you the opportunity to hear tips from coping in a COVID-19 environment, learn about real-world experiences that you can put to use and share with others, and engage with the calls on varying topics. So now, let's introduce Dr. Janice Leah. Dr. Leah is a professor of medicine at Emory University and is board certified in nephrology and hypertension. Dr. Leah's research and clinical expertise are in hypertension, chronic kidney disease, kidney health disparities, and dialysis. She's a nationally renowned expert in hypertension, designated a clinical specialist in hypertension by the American Society of Hypertension. Dr. Leah is designated a master clinician by Emory School of Medicine and serves as the director of telenephrology at Emory since 2017. Dr. Leah also serves on the board of directors for the American Association of Kidney Patients. Thank you, Dr. Leah. We appreciate your time and expertise on today's webinar.
Thank you. You're welcome.
So why don't we go ahead and get started with the questions that we've received from some of our patients so we can separate myth from fact. The first question that we received is, if you are asymptomatic, should you be tested again after knowing someone you have been in contact with has tested positive for COVID-19?
Yeah, this is an excellent question, but my answer is going to be yes, because we have heard so much information regarding people being able to spread the virus even though they have no symptoms. So if you were not properly protected with your mask and did not have contact with the patient by touching them, etc., sharing utensils, being in close quarters with them, and they since tested positive, even though you don't have any symptoms, and you recently were tested, we know that the virus can be present about 2 weeks before one starts to have symptoms. So I would say yes, especially for people who are at high risk, such as people with kidney disease, dialysis, and transplant. I would get tested again.
Okay, thank you for providing additional information on that myth. Now for this one, we heard from a patient, not everyone is wearing masks correctly or recommending when to wear them consistently. My nephrologist recommended wearing a mask all the time, even when walking outside or driving. When should a person wear a mask, and what is the proper way to wear one?
Well, certainly we've heard about the different types of masks that are available. You want to make sure the mask is fitting snugly over your nose and mouth. It can't be hanging down where the part of the nose is exposed. The entire nose has to be covered, as well as the entire mouth. Some masks, such as surgical masks that most healthcare professionals have, but also accessible to the public, have a little area right around the top of the nose that you can pinch, and that will secure the mask around the nose. So if it's just loose fitting, it's not providing proper protection. Now, whether or not you wear the mask outside really depends on who's around you. If you are just outside at your house and you're walking, no one is with you, you don't have to wear a mask at that point. But if you're out in a crowd of people or several people, people outside your home, etc., yes, you need to wear a mask. If you're driving in a car by yourself, I would say you do not have to have a mask on. But if you get into a taxi or Uber or with some other people that are not your immediate family members that you've already been exposed to and know what their exposures have been, I would say yes, you have to wear them.
Okay, thank you very much for that. The next one,
sure.
we know COVID-19 is airborne and affects the respiratory system. We are told to cover our mouths and noses. However, our eyes are a gateway to our bodies. Are the eyes another pathway to possibly contracting COVID-19?
I'm going to say yes to that question. Now, with that said, there's just recently been more sort of emphasis of the eyes. There have been some reports that the virus can get into the eyes, and that's why the healthcare workers, in addition to wearing a mask, have to have eye protection, either with a face shield or goggles. So if you are around someone who is known COVID positive, yes, you need to make sure your eyes are protected. Now, in the general population, it's not been recommended just being out with others that you have to have eye protection if you're not around people that are known COVID. Basically, the mask and hand washing, etc., social distancing are the main things that you need to do. But yes, there is a possibility it can get into the eyes. And when appropriate, you do need to have proper eye protection.
Eye protection as well. Okay. Now on this one, it's a true and false. A face mask and shield protects you from a person who is not wearing a face mask. A face mask and shield protects you from a person who is not wearing a face mask and shield. Is this true or false?
Well,
I know we just kind of talked about that a little bit.
Yeah, it depends on how much protection. It does provide some protection, but it doesn't provide complete protection. So that's why it's recommended that everyone wear the mask, not just people who want to be protected, because the other person can still spread the virus to a person who's wearing a mask, but the dose of the virus should be much less because they're having or wearing a mask, but it is not complete protection. So I think that's really important for everyone to know. If you're going somewhere and you're uncomfortable and there's people around you, especially if they're coughing or seem to be ill and they don't have on a mask, I would get away from them very quickly.
Good advice. On this one, can our pets develop COVID-19?
Yeah, I have to laugh at that one. I mean, you've seen some case reports. Again, I've seen it on the news. I don't have any firsthand experience with this, that there have been some pets, dogs or cats, that have contracted the virus. Not clear on the details where they received it from, if it was from a human transmission or from another pet, etc. But it is possible. I would say it's much less likely than with human exposure. But if you have pets and they seem to be exhibiting symptoms and ill, and that's not their usual type of behavior, I would be very, cautious with them, and of course keep them away from people. I wouldn't bring them to other, places where they could potentially get exposed as well. But it is possible, yes.
Thank you. And is it true that a person can get COVID-19 more than once?
Yeah, there's been a couple of cases on the news about this. And the other part of this is that the testing sometimes can be inconsistent. If a patient comes in the hospital, for example, the first test may be negative, the second test may be negative, and then the third test is positive. Likewise, after the test is positive, it turns negative, and then later may be positive again. And so the question is did they really clear the infection the first time, or did they acquire another infection? I do think most of you all, based on your interest in participating in this seminar, have heard there's a lot of unknowns about the testing and immunity and how long the virus is shed, etc. We hear new things almost weekly about this. So I would say that right now we don't know for sure. I would assume and say yes, it can come back because we don't have any specific time frame on how long your immune system is protected once you do have the illness. So if a patient has had it and they got better, then they get sick again, they should still go and get tested again because it might be a possibility.
Thank you. Kidney transplant patients are at higher risk of developing COVID-19. Is this true or false?
Yeah, this is a definite answer. It's true because kidney transplant patients, as well as dialysis patients, are immunosuppressed. And we know kidney transplant patients take immunosuppressant medications. And so their immune system is already at baseline suppressed, so they're more susceptible to all kinds of illnesses, viruses, bacteria, etc. So definitely those patients need to be very cautious. If they are in a type of work environment where they're exposed to many people, they need to find a place where they could be secluded or they stay home. I've written excuses for some of my patients. Doctors' notes to suggest if their environment is not proper, it's not a cleanly environment, it's not an environment where everyone is following social distancing, wearing masks, hand washing, that they need to not be in that environment. So definitely yes.
Okay, thank you. You will not catch COVID-19 if you are outdoors. True or false?
Yeah, this is a good question too. And again, it depends on where you are and who you're around. I mean, generally, we think that spaces that are not contained or enclosed, where there's limited ventilation, etc., would be a higher risk environment. And so being outside should provide some protection. And I would say, yes, that is the case. However, if you're in an area where, like a crowded park or a crowded beach, and there's people, that are very close in proximity to where you are, and of course, if they have the COVID virus and they expel those particles into the air, yes, you can still contract the virus. So just use that caution. It's all about social distancing, whether you're inside or outside.
Great advice. The long-term effects of COVID-19 include weak lung capacity and damage to the heart. True or false?
That's definitely true. The extent of which it affects the lungs and the heart may vary from patient to patient. As you all know, some patients have weathered this illness and had minimal symptoms, but then there's others who are in the hospital, ICU care, respirators, etc. And so those patients who have more severe complications are more likely to have worse long-term effects, such as poor lung capacity, meaning that they're always going to have some degree of shortness of breath, and then damage to the heart, usually what we call a cardiomyopathy, where they may be predisposed to having heart failure, etc. But this is still early in the disease process, and we haven't really followed people long term yet. So I don't know that we know the extent yet of some of these long-term effects, but we have had information that patients are still having issues even after they've recovered from the virus, cleared the virus, that they're still not feeling great. They still have some issues with their breathing. They have fatigue. We've heard a lot about the taste, the loss of taste and the loss of smell. I've heard those issues as well are still persisting.
Okay, thank you. And we have another true-false. Since I am elderly, if I had COVID-19, it would be more difficult for me to pass it on to my grandchildren. Is that true or false?
Well, yeah, yes, I would say, again, this one I'm not going to say is definitely true or definitely false, because it is more difficult, or I would say less likely for an elderly person to transmit it to a younger person. It's more likely the other way, the younger person, grandkids, transmitting it to the elderly, who are more susceptible and are more likely to get sicker with it. With that said, we certainly know that there are kids who have, especially recently, we're hearing more and more about younger people, even some babies who have contracted the virus. So it can happen to anyone. But it is more likely the other way around as far as the young kids exposing the elderly because they're more susceptible. Their immune system is not as strong. They usually have other illnesses such as hypertension, heart disease that all predispose them to having worse outcomes or complications related to really any illness, and particularly COVID-19.
All right, thank you very much for that one. And at this time, we still have some time left in this webinar series. We'd like to hear from you if you have any questions. I know we received a few through the chat, and I'm going to ask my colleague Jerome to help out and to provide some of those questions to Dr. Leah. However, if you have any additional questions, feel free to submit them through the chat and send them to all panelists. Jerome, do you have any, can you share some of those questions with us?
Yeah, we're getting some questions in, but first I want to get a little bit more info from Dr. Leah about her own experiences during this. You know, what have been your experiences during this time?
Well, it's been, as you would expect, a very trying time. You know, it's, you know, I, of course, deal a lot with dialysis patients, and so we've had to really be very vigilant about providing proper infection control procedures, protocols in our dialysis units. We have had some who acquired the illness, and it was very, very hard to see some of those patients actually died from it. We didn't have a huge number, but just a few that it affected. It was just very sad for me that, you know, and some of them have been on dialysis for years and doing very well, and then COVID comes and that's it. And so, you know, I've been really focused on making sure people are educated about the disease and their risk, because I think in the beginning, a lot of people didn't think it could affect them, and especially some of the minority populations, and then it turned out they were the ones who were most affected. And I think we've learned a lot as we've gone on about who's at risk and how to protect them, how to identify them. But it's, you know, it's been very challenging to, you know, for myself as well, my family. I have to be very careful, of course, when I go to work and exposed in the hospital, so that I don't bring it home to my family either. We have been able to use telemedicine, and that's been a great experience, and I think a lot of patients really like it. And I think that's one of the best things we've been able to do to help limit the exposure of patients and potential, even patients who just come into the clinic, maybe not dialysis patients, but people with chronic kidney disease who are just coming for a routine visit. And so we've been able to do that and do that very well. And so that's, to me, one of the, if there is a bright side to all of this, I think the ability to use telemedicine and see how effective it is and can be applied in the future, I think was one of the best things I think that came from this.
Yeah. You know, you mentioned loss, losing patients. How are you coping? How have you been coping with, you know, all the sadness, dealing, you know, losing patients? And any advice for other healthcare professionals that are on the call and patients on the call who may be dealing with something similar?
Yeah, well, you know, I would say that I believe that we all need to really support each other, and I think we all need to learn from this experience. I think one of the most negative things about this has been the fact that when the family or member is sick in the hospital and passes away, that the family can't be with them, and because of limiting their exposure. And so I think really people, I think taking the time, actually the pandemic has forced us to spend more time at home and with our families and really focus on what's really important, make sure your affairs are in order, make sure end-of-life issues are being discussed, and just being supportive and understanding of your colleagues. I mean, I think we don't even know what some of the long-term consequences of this are going to be for families affected by this and for healthcare workers, just all the trauma that they've gone through to witness this, and especially those on the front line, like in the ER and ICU. I think, there's going to be a tremendous long-term effects from this, less known with all the economy issues and all people losing their jobs. I mean, it's something that I think we all just need to come together and try to, support each other, understand each other and help in any way we can. And I'm going to end with the comment that as far as the pandemic, please everyone wear your mask, social distancing. I mean, it's just disappointing to see people still walking around in the grocery stores and without a mask on, and it's a simple thing to do. So I will, end my comment with that.
We did have a comment that came in, and it's actually from a network staff person. And the question is there anything we can do to help increase immunity, i.e. vitamin C or other supplements?
Yeah, that's an excellent question. There is a suggestion to, there's some recent papers about vitamin D, that the vitamin D deficiency may be contributing somewhat to COVID infection, or at least the severity of it. And we know a lot of minorities, especially African Americans, are usually vitamin D deficient. And so there is some suggestion that if you don't know what your vitamin D level is, it won't hurt to take vitamin D supplements. It's actually, I think, recommended 10,000 units for a couple of weeks and then reduce it to 5,000 units and just stay on that. Also, vitamin C, I haven't seen many publications about that, but vitamin C we know is good for the immune system. So I'm taking both, vitamin C and vitamin D. With that said, for dialysis patients, you take a renal vitamin, and that has all the vitamins that you really need. And you also know that you get vitamin D oftentimes at the dialysis unit. But the nutritional form of vitamin D, vitamin D3, is not something we routinely give at the clinic. But I would check with your healthcare provider, because if your calcium is high, you don't want to overdose on vitamin D either. So you do need to be a little bit more cautious about that. Vitamin C is not what we call a water-soluble vitamin, and so it's not removed with dialysis, so there's not a lot of it in the renal vitamin. So I would check with your healthcare provider. I wouldn't take huge doses of it, but if you want to take a low-dose supplement, that should be fine. But I would let your nephrologist know about that.
Well, Dr. Leah, thank you very much. That's all the time that we have for questions, but you provided some great feedback today, so thank you very much.
Okay, you're welcome. Thank you.
I'll turn the call over to Kim now.
Thank you. And thank you again, Dr. Leah, for your expertise and your time. We would like to thank the American Association of Kidney Patients for their partnership in the development of this webinar event. AAKP offers a variety of patient resources, including free membership And this year, the organization is celebrating its 45th National Patient Meeting, which will be held virtually. Information about that meeting and other resources is on the screen. And for more information, you can visit AAKP at www.aakp.org. We invite you to visit the kidneyhub.org. It's a secure, mobile-friendly web tool that was developed with direction from patient volunteers. It has resources for patients and professionals, and it's a place to go for COVID-19 information, resources about home dialysis, infection prevention, and more. The goal of the kidneyhub.org is to help patients and family members make well-informed healthcare choices. Check it out today with your mobile device and then follow the directions from the menu in the upper right of your screen to save it to your device's home screen. And just as a reminder, starting in August, next month, these webinar events will move to a new time and will last for 1 hour. Our provider-focused event is scheduled for August the 5th at 3 p.m. Eastern Time, and our patient-focused event is scheduled for the following week on August the 11th at 4 p.m. Eastern Time. You can still visit kidneycovidinfocenter.com for more information to register for upcoming events. We look forward to seeing you next month, and we invite you to share this information about the webinar events with others. We thank you again for being with us this afternoon. For additional COVID-19 resources, visit the CASER website at casercoalition.com, and then you can also review additional COVID-19 tools at kidneycovidinfocenter.com. Thank you, everyone, and please have a pleasant evening.